big news.
Hi, Ariel. Okay. Okay. Lawrence and Maribel, we'll get started now. So welcome, everybody. Good afternoon. Thank you for joining the Connecticut Health Foundation for our second virtual event for the Fellows Alumni. We are excited to have you join us today. And I just wanted to make a quick note. First of all, I'm Yolanda Caldera-Durant, and I'm a consultant for the Connecticut Health Foundation. And this webinar will be recorded to share with fellows that had registered but were not able to participate today. And I'm excited to be joined by Lawrence Young, who is a health fellow alum, and also Maribel La Luz. And today's topic will be about the COVID-19 pandemic response, communications and messaging in communities of color. So we're excited to have you all join us today. And I will turn it over to Lawrence, our moderator, to get us started.
Thank you so much, Yolanda, and welcome Maribel to this fellows convening. We don't really have time for us to introduce ourselves. I know many of us know each other, so you can do so during in the chat box if you want to send messages, give greetings. We'll have a little bit of time to engage shortly. Is Tiffany on? I think we were going to have a welcome from someone at the Connecticut Health Foundation.
Yep, she's with us.
Oh, hi, Tiffany. So yeah, we can have a welcome from you.
Okay. Hi, everyone. Good afternoon. I'm so happy to see so many of your faces, and this is wonderful. I will say that, you know, all of us have been inundated, overwhelmed, and also fortunate to be able to address COVID-19 for our communities, particularly for us at the Foundation for Communities of Color. And we have enjoyed taking the time to hear what is happening across the state and also to understand how each of you are responding. And I hope that what you're gaining from this session, or what you'll gain from this session, what you gained from the prior session, is ways that we can work together. This pandemic has impacted communities of color in ways that probably some of us expected because of the underlying health disparities we know in our state, but also in devastating ways that I would not have even been able to calculate, even knowing the disparities in our state. So we have a lot of work to do. We have a lot of work to do today, tomorrow, and ongoing. And I hope as the foundation that we can do this work together and that we can do this work with you. So I'm so excited that we have Lawrence moderating and we have Maribel here so that we can hear more about messaging for communities of color. We know messaging is important during this time, but also as we continue again to deal with this pandemic and as we face the next phase of a vaccine. Communication is key across the board. So I'm excited to hear what each of them have to say. And with that, I'll turn it back over to you, Lawrence. And thank you both, Maribel and Lawrence, for joining us today.
Thank you for having me.
Thank you, Tiffany, for that. A good way to set a context of today. So this is the second in a series of virtual events organized by the Connecticut Health Foundation to better understand and support COVID-19 efforts aimed at communities of color. Today, we're going to hear from Maribel La Luz about her work in communications and messaging to these communities with Governor Lamont COVID-19's task force. And the main goal, as all of our sessions, we want to identify opportunities for fellows to help advance this critical work and really find ways that we can get involved and promote in our individual communities throughout the state. And as always, we're creating a space for fellows to connect, learn, and really support each other with this. So as Yolanda said in the beginning, the session will be recorded and shared with fellows who are unable to attend. And this audience really is for the Connecticut Health Fellows alumni, but we hope that you share any good information with everyone else. So Maribel, I want to pass it on to you, and I want to invite you to introduce yourself and really level set with who you are, and give us a bit of give us some background of your work with the DECD.
Thank you. Thank you, everybody. Thank you, Lawrence. Thank you. Good afternoon, fellows. My name is Maribel La Luz. I'm a senior advisor at the Connecticut Economic and Community Development for the state of Connecticut. I just want to say, just right off the bat, that I'm really honored and flattered to be asked to be here. My preference for this discussion is that it is just that. It is a discussion. I would like to keep this, somewhat informal, because I'm going to be talking to you very sort of frankly about the work I do every day, the work that I was just doing 15 minutes before I got on this call, and the work I will be doing 15 minutes after I get off this call. So I want this to be, I want you to ask me questions and I will do my absolute best to provide you some helpful information. As I was just telling Yolanda at the start, I was kind of on back-to-back Zooms this morning, Teams, whatever. And I can tell you that you have an administration that is completely focused, very, very focused on communications and messaging, partially because that is kind of like the governor's background. So that's very important. And because you have a lot of experts and you have a lot of people who know what they don't know. And so there's a lot of discussions right now. I can tell you that we are, focused on delivering some recommendations for CDC's new guidelines about quarantining. I'm sure everyone here is familiar with that. That'll probably be the topic today for today's news conference. If you don't know, every Monday and Thursday, the governor does at 4 o'clock Eastern Standard Time, the governor does briefings. And that's where you really can find a lot of information, and a lot of information of what's up and coming is telegraphed there. So we'll probably talk about some of that, and then we are hyper-focused on communicating about what will be the vaccine, what will eminently be the distribution of the vaccine. But what I will say is that this month of December, and this is just for everybody, look, this is going to be really hard. It's going to be a tough month. It's going to be a brutal month for all of us for every single reason that you already know. So it's the holidays. Again, I don't have to explain, but what I can say is that, hopefully if we are able to distribute the vaccine to some of our frontliners, nursing homes and all those sort of essential workers, and we're able to do that, hopefully, by the end of January, and we're able to communicate that is happening, we will be able to create a sense of optimism that we'll start to see that, and we'll start to sort of shift. And we can all start to think about, the future, in a different way. But I can tell you that, hang in there, for a couple of months. I just feel like we've had this in our mind that, like, by January 1, it's going to be done, we'll be all right. And I know that that's not the case. So but we will not, there is no work if we're not working together. So we really rely on groups like this and networks that we've created. And I can talk about that because I'm of the opinion that government's role is to either, provide the resources for individuals or groups like you to do your work, or enable you, give you the tools to do your work. And so we really rely on stakeholders to be able to tell us what's going on, what we're doing, what we're not doing, what we need to be doing, and just deliver this information, because all of these solutions and all of these conversations, all of the stuff that's going on is still at the end of the day an exercise and exchange of information. So, and this is information that is changing in real time. So I just wanted to say that I hope this is an informal discussion. Let me just give you a little bit of background as to kind of how I got here, and I think perhaps why I'm here. I've been in marketing communications for a long time. I accepted my fate in government and politics a while ago, and I just, I gave in. And I was brought into this current administration by the governor. I was the former spokes for the administration. I'm currently the senior advisor to the Commissioner for Economic Development. So my day-to-day is really dealing with the business side of it. You know, what's going to be the right now, what's going to be the impact to our businesses, and we're hyper concerned about our small businesses because those are the largest employers. They're women-owned, they're minority-owned, you know, and as with most things in life, like the ones who, if you know, the most vulnerable populations or the most vulnerable businesses or the small mom and pops are the ones most affected, right? If you're vulnerable before, it doesn't change now. So it's that's sort of my day-to-day. But once the pandemic sort of hit back in March, so to speak, which feels like, I don't know, at least 10 years ago, but once that hit, we being just sort of the state in general, and the commissioners created sort of this unified command. And so what ended up happening was that I, along with the Department of Public Health and the Office of the Governor, created an infrastructure around communication, around internal and external communication, to be able to figure out, again, this was information's changing in real time. You know, we didn't know, but we had to be able to communicate internally and be able to communicate externally. So we kind of created a structure around that. And I directed what was sort of the Joint Information Center on that. And so we ended up creating processes, social media, and then I largely became involved with stakeholder engagement. So that's outside of the traditional media and the sort of day-to-day press and news, but how to make sure that our local communities have information, they have the tools to communicate. And then from there, ring-a-ding-ding, you know, I was, you know, again, you have an administration who understands they know what they don't know. It became critically important that we are able to communicate what is happening with COVID to populations that are vulnerable, which is basically just code for Black and Brown. And those communities have, you know, a historic, they may not be watching a press conference at 4 o'clock because you might be working. But there's also an inherent and historic mistrust in government with good reason. And so, and, you know, and then you kind of add in you know, the racial justice things that were happening at that time that I don't think I need to go into, but I was very clear. And I remember very, very often saying in conversations, like, you have to keep in mind that you're talking about something that is going to create an enormous amount of pain to communities that are already in an enormous amount of pain. So you know, those were the basis for the discussions. And then I remember you know, the idea was we needed to create some sort of tools. We needed stakeholders to communicate with their constituents. So what I mean, like, you know, we need organizations to talk to their members, to tell them to quarantine, to get tested. Do they know the resources that are available? Do they know that they can get PPE? Where is that? Is it in their language? All of those things we need to be able to provide that information to organizations, you know, like yours, like the Health Foundation. So I partnered with Ariel, and we kind of created a campaign that was focused solely on messaging to Black and Brown communities. And I'm happy to share that with you. But what I think the top line message is that what that has done is that now, out of that process, some things are just part of the inherent structure. So now anything that is communicated through COVID, we have established a ethnic media group, right? For example, small ethnic media group that's within the local communities. They were brought in early. We're talking like end of March, we established this group, and now there's going to be like an actual board. They're going to operate like a board with chairs and rules and stuff like that, but they need to receive those information, which, by the way, they're also small businesses themselves, but they need to get access to this information and input and provide information and give us feedback. Those are part of our regular work stream now, right? We created customizable toolkits. I call them, they're electronic toolkits, right? So for example, we need certain populations to start getting tested, right? Now, that there is a huge resistance to getting tested, because first of all, the whole idea of getting tested is scary, because what happens if you test positive? What does that even mean? Do I have to tell my employer? Am I going to get fired? Did I not see my family? I can't go. There's so many reasons that would make somebody fearful. Is there a cost? Where even is it? What is that? What is this needle? Where's the swab? I mean, there's just so many, it's such an uncomfortable thing. So we had to, understanding that that was real, that there's a mistrust and a lack of information, we rely on trusted sources. And what's that? That just means someone that you trust and that you know that's giving you this information, right? So let's say we rely on churches, nonprofits. Hey guys, these are your members. These are the folks you talk to every day. We need you to tell them to get tested. Okay, thank you, state of Connecticut. How do we do that? So again, a tactic that we tried was like, all right, look, we're going to give you this information in hopefully some sort of creative fashion. Here are the key facts. Now take this information, it's customizable. Here is a fully baked social media post in English and Spanish. If you need it in another language, great. But here's a flyer. Here's different images of a flyer that you can use, download, and customize as you see fit. Because a church group or a nonprofit, they're not marketing agencies. They may not have, the staff to be able to do this. So it is our job as a partner, as in public service, to provide you the local community organization or whoever, the stakeholder, with some tools to do that. And so that's just an example of kind of some of the stuff we created. And now, unfortunately, we're having to ramp up again, because as you know, there's an uptick in COVID. Now these things are sort of part of the general, the best practices. And we continue to try, and we're going to have to do this again. We're going to have to do this whole process again when it comes to communicating about, the vaccine, and because we still have all of those same challenges. So this is just, again, this is just a sample of it that you can see. I mean, I don't know if anybody can even read this, but because my eyes are really old, but I can tell you that we basically fully baked a guide for organizations to email, share, to present, and those images at the bottom explain, we tried to get to the heart of the matter, that we understand that it's scary. It's a scary process to get tested, to know. But the fact is that knowing is the only way you can protect yourself and the things that you care about the most, which is your families and your neighbors. And if you don't protect yourself, nobody else is going to. So we kind of tested this out with the group, and we came up with the idea, the slogan, knowing is better, because not knowing could hurt you in the things that you've worked very hard for. And in Spanish, we did hasta la prueba, fuera COVID, get back off COVID. And we kind of walked through these different images, and we explained the process of what testing actually, what does it mean? Like that thing you see on the right is an actual just step-by-step chart. You might get a call, you might not get a call. And now we have through 211, if you go to our site, if you go to ct.gov/coronavirus is my catch-all, frankly, guys. You can go to knowingisbetterct.org, that's fine. But all those resources are kind of there. And you can put in a zip code and find out where to get tested near you. So I think what's important to know, and I can tell you this honestly and truly, I am known for being quite direct, is that there is a lot of individuals and a lot of groups very, very focused on communicating and getting information from our most vulnerable populations, because every single conversation that I have been on, and I can tell you that I've been on a lot of them, the science says if you can curb the spread in our populations that are most vulnerable, that's your biggest shot. It's your biggest chance. stop, to stop the spread in general. So I can tell you that we are hyper-focused and we rely on these established networks to provide information and to get information. So I'm going to stop there because I just kind of want to hear if you have any questions. And again, I'm happy to elaborate as needed. But I can just tell you that this is some of the work that we're going to do every single day. We're going to continue to do now, even through the legislative session.
Thank you so much for that. I do have a couple of questions for you. You've been very forthcoming and very honest about some of the challenges that you all have faced with this messaging. But I'm curious, I think I want to be a little bit optimistic and ask, what are some of the successes? What are some things that you think as far as messaging that's working? And what are some good things that have been coming out of this?
I mean, hi, Ariel. I just saw you there. I mean, look, at the risk of sounding, I think it's a good, something that is positive that has come out of this, if there's such a thing, is the collaboration and the coordination that is going on. As an example, we were establishing groups regionally to address long-term economic recovery, right? And again, this is dealing with our most vulnerable groups. I get a call 10:30 from our Office of Early Childhood saying, we have a childcare. I mean, this sounds so, I know this sounds so like duh, but I mean, again, keep in mind that we're all just trying to, figure things out. We can't have economic development. We can't grow if we don't have childcare. It's just not, it's not a thing. And also childcare providers happen to be what? Women-owned businesses. So that idea is now fully baked into what needs to be our plan going forward, period. It's in higher ed, it's in our long-term economic recovery. Now with the new chair, I was just saying that the new chair of the Appropriations Committee is Rosa DeLauro. That's one of her signature issues. So these are things that are being considered, and I would consider the collaboration and the communication, the internal, because your external communication relies solely on your internal or your lack of. And so I would say that collaboration is probably one of the most powerful tools or the most important infrastructure that has been set up. And I think that the fact that it is now an inherent part of the process that things that come out of DECD are in both languages, that all the communication for COVID is just off the bat. We think about individuals with disabilities. We think about things in multi-languages. We think about stakeholder engagement. We think about trusted sources. I mean, I don't know if anybody on this group is on the governor's advisory group for vaccines, but that's that 50 people that are talking about how to do this, consistently. And that's really important because when the information's out, we're going to rely on that network to reach their respective communities and vice versa.
Thank you so much for that. I have a couple. I'm not going to ask too many, but you mentioned it again, a buzzword. You used a lot of trusted sources. Could you share with us about who some of those people are? Like, what are some people you're directly connecting with? Whether they're organizations, any huge churches, just groups of people, grassroots. And I think I'm asking that for synergy because I want to really ignite people who might be on this call. They may be working with some of those groups as well. So who have you been working with?
So as an example, just in my day-to-day, so we're doing community lending. We're trying to, we have to figure out for small businesses. A head co would be an example of someone who is a trusted source because they are in their actual community. And I, as a business owner, may not be going to, first of all, brick and mortar banking is, that's brick and mortar is changing in general, but maybe I'm not going to go into a Bank of America to get a loan, but I might be more familiar with a head co. Churches those are low. I mean, there is a faith-based group, statewide, that meets with, the governor has met with them. I mean, and by meet, obviously I mean Zoom now, because that's what meeting is, that has consistent communication with the governor's office, and it is statewide. I would like, if you want me to name names, I will, but I can tell you that there are going to be names that you will recognize. But yes, it is. Yeah, we have a faith-based.
Yeah, I think that will be great. I mean, but I think that I don't want to take up too much of the time. I think I got a good gist of what you're saying.
Yeah.
I do want to, just give I was going to ask one more of a question about specifically health equity. I know we talk a lot. That's a big buzzword for this group. So how is and you mentioned a few things, a few people that you're targeting, but do you all have a statement or just kind of a strategy around health equity in your messaging? If so, please share that with us.
Those are professionals that are, so for example, I just got off a call where Vicky Veltri, I mean, those are, the entire advisory group is focused on equity and access. That is, it does not happen without that. It's not an effective strategy. So I can tell you off the bat that those are professionals that are involved with that every single day. That's outside of my purview. But you cannot have an efficient strategy for vaccine, where I can tell you my involvement is on the communication side of it, right? So here are the two groups. We have to simultaneously communicate with frontliners to tell them to get the vaccine, because it's not, we can't mandate it, right? This is still voluntary. So it's frontliners, and then vulnerable groups who need to be vaccinated, teachers, so I mean, we are literally consistently having those discussions. If you're talking about a mission statement, I can just tell you that, there is no mission without equity and access. I think we have stated that over and over and over. But I would encourage you, if you want specific language, I can share with you, I can directly share with you sort of the members of some of that advisory group. And I encourage everybody here to reach out to all of them, because that's what they're there for. They meet, their meetings are public. The strategy, I believe, is going to be delivered either, by the end of this month, and that's public. All of that is public.
Great, thank you for that. So I hope
that's helpful. I hope that is helpful, because there are ways to engage.
Right, and I think we're really flowing information right now. So this is really good. You gave us a good place to start. Now I want to excitedly invite some of the fellows to actually speak. I know, Yolanda, we're going to just ask the fellows to ask questions openly. Is that what we're going to do?
Yeah, people can ask questions. You can unmute yourself, or you can also include your question in the chat box.
Yeah, if you type in the chat box, I can read it out. Also, Yolanda did say that she is the mute button owner. So if you get a little long-winded, but we want to give everybody a chance. So I'll go to the fellows, and I see a few popping up in the chat box. I'll go to the chat box next. Any fellows want to ask any questions, please go ahead.
I'm going to go into the chat box now and just post a link here. Sorry, it's a kind of a long link, but for anybody who wants to take a look at some of the advisory group members for the vaccine specifically, and there's probably a schedule there, or a link to a schedule there of when they meet. And those are public meetings, and you guys can listen in. There's three main groups. One is sort of the main advisory group, and there's an allocation group, and there's a subcommittee, which is just around communications.
Great.
And their job is to present their findings, right, to the governor, and then we go from there.
And I guess I did get a question in the chat box about vaccination mandates. So can that, or will that change about things not being mandated? Is there any
There's you can't mandate. No, you cannot. We're not. That's
great. And also, I think Darcy just asked the question, will there be any televised PSA commercials promoting the vaccination?
Yeah, you guys, and so yes. The short answer is yes. I'm sure, I assume, this is no secret, right? For many months, we operated on the premise that we were going to get another federal stimulus after this sort of the pandemic came on the first round. We were operating that premise for many months. We are now, we had to stop it because when we realized that there was no more federal sort of dollars coming in, that I can tell you is, we are all kind of, obviously Connecticut and across the country is crossing their fingers that this happens. I'm not optimistic that it will happen before the new administration takes in, but we're free to hope. But I can tell you that that's what each state is absolutely relying on. But yeah, so there's traditional means. There's if you're talking about traditional sort of media being used, like radio and social media and television, billboards, ads, you know, all that stuff has to be, you have to do a full-blown, full-court media plan for that. But also, you have to do this. You have to hear it from your local community groups. And so you have to provide the information, the tools, and the resources and the facts so that they can deliver. And don't underestimate word of mouth.
Great, thank you. So I see a few things popping in. Anybody want to ask their questions aloud? We welcome a conversation. I see some smiling faces.
Tiffany is on there, so she may have some insight. She's on the communication task force for the vaccine, I assume, which is great.
Yeah, I am. And Takesha is actually on the full advisory board as well. You know, the group right now, we've had 2 meetings so far and really trying to organize around stakeholders and who we need to think about the communications approach for and who needs to be the messenger. So all of that work is just in the beginning phases of us organizing around who, what, when, and where. Takesha unfortunately had to drop, and I do unfortunately, but Takesha I'm sure can provide at another time. And I think what we can do is that for another one of these sessions, maybe in January, give the most an up-to-date on what's happening with the vaccine advisory committee. So I think that would probably be a good conversation for us to have as a group. And hopefully by the end of January, we'll have more to share. The group is moving quickly because we don't have a lot of time. So I think by January, we will have more to share.
Thank you so much, Tiffany, for chiming in and staying a little bit longer for that. I see Dr. Katina, are you raising your hand?
Yes, I am.
Go ahead.
So, Tiffany and all of you, hi. I'm a fellow from 2008, so I'm old and sometimes not wise, but I always keep saying the same thing. So I just went into the website, saw all the members and read through the entire list of the advisory committee, and it's all important people. You know what I mean by that? I mean that they are in positions of power, and that's important, but they are not really authentic community people that are gonna get to the ground. Why do I have to repeat the same thing in every single meeting that I go to statewide? And because I don't know you well, I'm not swearing, because I'm well known for swearing in 2 languages. You know, number one, there are no representatives by county in Connecticut or town that know the particular general culture of that community. I mean, we are in Windham. Do you know when the economy is depressed, we never feel it because we have always been depressed economically in this area? We are not Fairfield or other places. You know, I'm just saying that authentic representation also needs to be heard in these upper level places, like regular people. Thank you for letting me rant.
No, and I really do have to hop, but I do just want to also mention that we recognize that as a foundation. And even as we provide names, oftentimes they're names of people who are on the ground. They're not always selected, but we are trying. The reason why I have to hop, however, is to mention for 2 minutes on another call, the fact that the foundation did create an advisory group, a collaborative of community-based organizations, but not just community-based organizations. We asked each organization to bring along a community member to really talk about how COVID-19 is impacting the community. And we spanned across the state. We made a concerted effort to get insight from across the state. We did this in collaboration with state agencies. So we've already had 1 meeting, but we had representation from DSS, and not just representation, the commissioners came from DSS, from DMIS, from the Department of Children and Families. Also, Commissioner Porter came to hear what's actually happening on the ground in community. And the reason why I bring this up is, Katina, you're absolutely correct, that oftentimes we're not hearing directly, and we choose representatives with a lot of letters that follow our names, and I'm one of them, and that's been selected. So as a foundation, we're also trying to find creative ways to elevate the voices of people who are really on the ground to state officials. And I know Stephanie is a part of that, representing your area in New London, and she's brought a community member along with her. So I will mention that we have to just keep doing that. And if there are other ways that the foundation can get involved in doing that work, where we are open, willing, and wanting to do that. And I have to hop, but I'm gonna let Stephanie chime in, because I think she had a question as well, but if she has anything to say about the collaborative, she would have more experience in that from her experience.
Thank you, Tiffany. And I was actually going to, as part of my question, I was going to mention being part of that collaborative. And a lot of our conversation centers around how information is actually not getting to the folks who are on the ground. So that was going to be my question, because you mentioned working with a lot of trusted sources and community groups. And so I was thinking about all of the conversations that we've had with that collaborative, but also thinking about all of the spaces that I occupy in Southeastern Connecticut. And the only time that I've heard of any of the toolkits or things that are on the website are like, hey, did you guys know that this was here? And literally everyone on our collaborative was like, what? No. So I'm curious.
No, we don't. It's not. I don't mean to imply that this is we have done a great job. We wouldn't be here talking about it if otherwise. Like, this is a constant challenge, and this is going to be a constant issue. And because there's so many challenges in communication just inherently, like just getting the information out. The information changes to the next day, and then there's absolutely. That's why we need to, my hope is that this sort of, some of these structures, some of these networks, some of this information sharing that we're doing does not, because there's a difference between what's required for the response and recovery of the pandemic, and then sort of long-term, good, sound public policy. And so we have to think about all of those things. And this is an issue. This is an issue that we have to deal with. We need to do more. We need to do better. We need ideas. We need help. So this is a constant moving. I'm happy that you even said you heard about the toolkits. I'm like, oh, geez, because it is, you're also, again, you're also, again, talking about people who, nobody's sitting around waiting for information. People have jobs, lives, responsibilities, fears, things to take care of. You're not sitting there waiting for somebody to tell you something. So there's tiers to that, right? You're always going to have, no matter what, you're always going to have sort of these layers. Like, there are just groups, there are people who are just connected. They're more active. They're activists, right? They're just, they know. And that's why some groups and some people are worth 20, because they share information. So this is a problem. It is an issue. We're aware of it. We need to continue to deal and do a better job, and take any kind of, my role, what I believe could be the most productive thing, hopefully, is I'm letting you know where the people are, where the networks are, where to find the information. What else do we need to do? To get that information. Here's what's coming. Here's some of the benchmarks. Here's what we're going to talk about today. Here's what we're focused on. What else do we need to do? Absolutely, this is the challenge. We're not 5 stars or points on the board on any of this. This is it. And this is also a subject that, again, is really complicated and really scary.
So I appreciate your response. Thank you. And I promise I won't take too long. I just want to reiterate, the only time that I've heard about the toolkits is one, when you mentioned it, and when on our collaborative, someone from Connecticut Health Foundation saying, hey, did you guys know about this? Outside of that, I didn't hear it. So I'm going to say this. I am a trusted resource in my area. And so, and I'm not saying that I know all of the things or have all the connections, but I'm saying that people trust me to ask me questions and get information. And what I'm saying is that I had no idea about any of the information. So there's no way for me to get that information into the hands of all of our vulnerable populations that you mentioned. Like, there's no way for trusted folks to get it if it's not being given to us, and to assume that we're just going to randomly go on the website in the event that there may be a toolkit. That's
and it'll never be. So here's what we put that out. We did an ad campaign around that. We did a radio campaign around that. We did a social media campaign around that. We e-blasted it out to over 10,000 people. And again, we sent it out to our local health districts, presented it to our local health districts, presented it to our local economic development directors, presented it to an entire faith-based community, had it translated in Chinese, had it translated in Spanish, Portuguese. And I say all that to say, those are some of the, kind of, we have to do those things just naturally off the bat with everything. And still, we need your help. So please know that it doesn't work. It is not going to be as efficient as it can be without your knowledge, awareness, and assistance. So, happy to plug you into whatever you need to get that information out.
Thank you so much. And I wanted to really make sure I got most of the questions in the chat box. I got one that just popped up to me privately just to make sure it's about the vaccine again. And just you answer this to the best of your ability, Maribel. So people who work in the supermarkets, like drivers or like services where they have to be out and they're essential, but they're not in the medical field, where do they show up in the line of priority for the vaccine? Do you have any information about that?
I don't have any information about that. And that is a coordinated strategy. And I'm sure.
Okay.
And I'm not sure who else besides I'm not sure exactly who else is on that advisory group, but that is part of what is being discussed now.
Great. Okay. So I know.
And I'm not trying to get ahead of that is a question of, but I can tell you that priority populations, essential, all that is being discussed now. And we're not the only state dealing with that, right? So that is part of a discussion that is happening right now. And it will become clear.
Great. And I'm going to look at the chat box for more questions. I had one more vaccine question, but it's very similar to the last one, so I won't do that. But do we have any more questions? I think I may have a couple of more, but I do want to make sure that the fellows have a good time to interact. Please feel free to chime in if you have any more questions for our speaker.
And
I do.
Oh, sorry.
Yes, please.
It's Linda. I had a question. Hi, Lawrence and everybody. I had a couple of questions. So, but in the context of the messaging and the timing of the messaging. So,
which messaging specifically?
Well, I'm going to give you an example because it's not just about testing and vaccine. There's a lot in between there. So when the contact tracing, the first I heard about it was a pop-up on my app, on my phone.
Yes.
There was no context. I hadn't seen any, and I was like, I wasn't sure if I was hacked, and I know a lot of people in the community said there was no way they were going to download it. And then like a week or two later, I saw a commercial about it.
Good.
So, yeah, but by then, it's which comes first, the chicken or the egg kind of thing. And so I just wonder, like right now, given the distrust in the community about taking vaccines, you know, how are you timing out these things? And I also know you're saying you're going to discuss about essential workers, but I think frontline workers need to be recognized as being redefined. Bus drivers, grocers, they need to be second in line, because they have been bearing a disproportionate burden throughout teachers throughout this whole time, and they were suddenly reassessed as essential, and they cannot be downgraded when we get the vaccine. So I just want to make sure that they are, you know, front and center in the discussion among the governor and who's representing that constituency.
That is, again, those are, once again, I don't want to get ahead of any of that, but I can tell you, you're not alone in the points that you've just made at all. You are not the only, you are not alone in that thinking and that approach. And those are some of the really difficult decisions that are being discussed right now. But in terms of the app, the contact tracing, that was, we released that, I want to say like a month ago now, and approximately 23% of the total population of the state has downloaded the app. Less percentage has actually cashed in on their coins, which is, you know, the usage of it. And those things take time. It takes time to even be comfortable with that, because those are that comfort level, you know, supersedes socioeconomic backgrounds, right? Someone just may not be comfortable with downloading the app. But we did, you know, but keep in mind, there's the app. The next day we have to talk about the vaccine. So there is multiple communication objectives here that are changing all the time. And so I'm happy that you saw some information about it. I can also tell you where to go if you have more questions about that contact tracing. And that was one of the biggest challenges and the barriers, right? Because I test positive. So my information is confidential. You don't, you know, in certain groups, you don't need insurance. So I saw somebody asking about without health insurance. Of course, that's not. So of course, we're going to reach out to just, you know, everybody, but you don't need health insurance, right, to get tested if you're amongst a certain, you know, vulnerable population in certain areas, certain geographic areas. That information is kept sort of within these confines, but then you in order for it to be effective, you have to have contact tracing. So someone has to contact you to say, hey, please quarantine, or hey, have you been in contact with anybody else? Because that's how you stop the spread of the virus. And so that was a really hard thing. And so we made sure, one of the things that we tried to do was to say, you know, what is this contact tracer saying? Do they speak multiple languages? Are they telling the person about the resources that are available to them if they test positive? Does the person do they have food? Can they quarantine? Like all that information, like that actual touch point is really, it's really tough, but it's also necessary to stop the spread. And these are really hard conversations, because, and then just to see, we had discussions about what's the phone number that the person sees when it calls, when they actually get a call on their cell phone. So we're thinking about it, and it is a big challenge.
I have a question based on your feedback. Within that toolkit, are there answers to those questions and points that you just raised around contact tracing? Because that is a message that I'm going to
send you guys to another site that has several buckets of information to see if it is helpful for you. This toolkit that I've just pointed is just one. There's several. This one was strictly around testing for vulnerable populations. There's groups that are talking about contact tracing. There's groups that's talking about volunteering. There's regional support groups that are talking about being able to isolate and quarantine in their local municipalities, figuring out do people need care packages? Do they have places to stay? So there's all those conversations. I'm going to try to direct you to see if it's helpful. And I'm always, and one of the I operate in this fashion. I'm always reachable. And if I don't have an answer, we can direct you to somebody else who does.
So all of this information is kind of siloed in separate pockets, which kind of makes it then hard for folks to really navigate, which is probably why there's not so much connection, you know, and tracking with it. If hopefully someone will be able to take back to the body that putting all of the toolkits together and putting all of
where
it
is. Yeah, I'm going to send you a site where all of the toolkits are together. Exactly. Okay. So you can take a look and see and use as needed. Share far and wide as needed.
Thank you.
Of what is existing as of now.
Thank you so much for that question as well. I'm gonna ask, do we have time for one more? Well, we have a little bit more time. We can take one or two more, you know.
We do, definitely. But Lauren, something that's come up, and my name is not Tamisha, it's Yolanda. I didn't change the name of the Zoom account. So one thing that I'm hearing from the fellows, Maribel, and I don't know if this is a question that you can answer, but this is really something that's coming up in a strong way, is around an influence strategy. An influence strategy for this vaccine working group and these subcommittees around prioritizing frontline workers who are, you know, who represent communities of color to actually receive this vaccine. And I think it's an important point, and it's an important concern. And I'm just, you know, just wondering, you know, just here among the fellows, right? You have people who are working on the ground in their communities, and, you know, this working group needs to hear about the importance of making sure that frontline workers, essential workers, bus drivers, you know, childcare providers, you know, people that are on the front lines, who are predominantly people of color, that they get prioritization when it comes to the vaccine. So if that's an op-ed, if that's an op-ed that needs to be written in the newspaper, if it's a letter to the governor that needs to be sent, like this is the time, and it has to happen.
I think you have some of your own representatives on that advisory group, but so the frontline workers, and again, this is all sort of, I mean, these are nursing home staff, because that's where the proliferation of the virus has been. First responders. Oh yeah. Those are all considered frontline workers. So those all have to be prioritized. But that information, I believe, if I'm not mistaken, that is it Tamisha that is on that advisory group? And there's one more, and Stephanie?
It's Takesha, right?
Yeah.
Is it Takesha and Stephanie?
And so and Stephanie's on that one too? Okay.
No. Oh, Tiffany. It's Tiffany.
Tiffany.
Takesha and Tiffany, pardon me, tongue tied over. Yes,
it's the E part. It's the E, the Stephanie and the Tiffany. Correct. So you're gonna find, I mean, hospital staff. So I mean, there is all of those segments of the population that are considered, that have close proximity to people that have the virus, or you know, where the biggest proliferation is, are some of the essential frontline ones that you have to get, that are just top. But keep in mind that it's still voluntary. This is still voluntary. You know, you cannot make people get a vaccine. So you have to educate. There's an education component. And I know that we're talking about this, but the vaccine was just announced 2 weeks ago. Literally, that's like 100 years in our world right now. But I can tell you that there's a lot of people, just based on I can hear on this discussion right now. I mean, I'm assuming that once this information is public, that this is going to be taken to the folks on, you know, on this group, and there's going to be a full-blown information campaign and education campaign to try to get this information out as much as possible. And anybody is welcome to contact me or contact I can share any contact information that you like with folks who have, but it sounds like you are already connected to those networks, at least to the one, at least specifically about the vaccine advisory group.
Great, and I think we have a question from SB. I saw that you, we have a little time, so go ahead if you're.
I feel like I know SB, and I'm not sure how.
You probably do.
I'm all over the place.
You sure you do.
Maribel, thank you very much for this presentation. This has been most informative. See, I'm also an economist. I study economic development, and I was part of the DPH's economic security working group when they did the 5-year SHIP, the state health 5-year planning. We just finished that, and the first draft is out for public comment. And what I did for the past several months is really look at the economic security aspect, and that is a major social determinant of health, no doubt about it. But what I found was some very, very profound statistics, and you're in DCD. I mean, this is really in your neck of the woods. Some of the policies that we have had, and I've lived in this town for almost 4 decades, 36 years. And some of the policies that we have had for Hartford are so wrong, and it is continuing right now. 30% of Hartford's residents are under the federal poverty level. 30%, almost 1 in 3. I found some statistic in economic security that was really, really profound. And we really need to open it up. My solution is to have the governor open up an independent, like a nonpartisan state commission to look into economic disparities, the huge income inequality and so on. There's a lot of development downtown Hartford. They're building all these affordable apartments, but it is not affordable if you don't have a job. And a lot of them are rentals. They're not ownership. And if it is not ownership, it means there's no wealth building, the income disparity widens further. So I'm sorry about this big rant, but this is something we have known for a long time, but it really kind of hit me this past several months that I discovered it and I got the numbers and all to prove it. So since you're in DCD, what would you do about it?
Yeah, no pressure. Listen, this keeps us up at night, like what to do, because when it comes to economic development right now, I'll give you an example. I mean, again, small businesses are like 90% of the businesses in the state. They employ 49% of our total employees in the state. When you're talking about small businesses, you're talking largely, there's a lot of women and minority-owned businesses, and these are entrepreneurs, So
yes,
one of the things that we did, so and the application closed. So we and this was, driven very much by the governor and priorities. We just recently, there was the federal loans, the PPP loans, the EIDL loans, and we knew this sort of anecdotally. We did a survey, and of course, we found that, guess what? There's a lot of people who did not access those loans because their fear of incurring more debt. You don't know what it means. You don't know where to go. So we kind of we created a $50 million grant program that is for small businesses, specifically for businesses that are either less than 1.5 annual payroll or 20 employees or less. And we included sole proprietors in there. So if, one person business was included in there. And these were grant funds that don't require repayment. And we were really, really careful in trying to make this application process as simple as possible. I mean, we're not, because again, it's a grant that has to go out the door by December 30th and does not require repayment. So we're not, we don't have to look at, your firstborn here, and it's not a loan. So we tried to make that process as straightforward as possible. So that would be for 10,000 small businesses. Again, those are largely women-owned businesses. 10,000 small businesses at 50 million, 25 million of that allocation would be for what would be considered a distressed municipality. So, places where I have congregate settings where there's more people, where those businesses have been hit. And we just made it so everybody gets $5,000. It's not a lot of money, But for some businesses, that could be, you know, that could keep the lights on for another month. That could pay an employee, you know, another hour or two. So we know that that's just some, but we have to continue, you know, we have to continue to find ways, you know, to help our businesses. And it is very difficult, because I go back to what I said before, because, you know, the growth for the cities for so long was to have, you know, people on the street, right? More populations. Right now we're in a time and a place where, like, everybody's home. We don't want people around us. So the cities are really impacted, and it's a challenge. But that's one example of some of the things that we're just recently doing. And we're going to continue to see how to do more of that as the months progress.
Yeah, thank you very much, Maribel. I appreciate it. And I'm actually working with some other women business center about this problem. Good. It's a huge problem.
Good.
Thank you so much for your question. And thank you, Maribel, for talking to the fellows today. We really appreciate your insight. You taking some really hard questions, and I hope they'll have a lot to think on, and we can keep sharing the information. I just wanted to close with that. We have an upcoming Connecticut Health Foundation webinar in mid-December for a virtual networking and connection of the fellows. More details to come about that. I also want to ask all the participants to complete a brief feedback survey to help Connecticut Health Foundation understand what went well and how we can improve the future convenings. We will also share the PowerPoint slides, participants list, and this webinar recording afterward. And so thank you all again for attending. Thank you, Maribel, for speaking, and we will be in touch with you very soon.
Thanks, everybody.
I just put my email there in the chat box in case anybody has any follow-up questions or needs to reach me.
All right, thanks, Maribel.
Thank you.
Thanks, Lawrence. Have a good day, everybody.
Thank you. Bye, everyone.
Bye-bye.